Hey, care partners. Welcome back to Memory Care with Teresa Youngstrom. So glad you're here. We are so excited to be putting this out there across the states, and now we're learning across the country and into other countries. It's so great that you're sharing the information and getting it out there to those that need it. So that's the goal, right? To share this information and to keep putting out better and better information for you concerning dementia and all the different areas and aspects of dementia. So I'm excited to report today. We've got some guest speakers to come on with us today. And so I want to introduce from Texas, Dallas area, that I have Emily Briggs and Lori Walters with me today. So let's bring them on. Hey, ladies, welcome to the program.
So thanks for having us.
Thank you for having us.
Absolutely. So we know each other. We're all certified in some way, shape, form under Teepa Snow and our colleagues in that respect. And I'm delighted to have you on the podcast today because you just bring a different aspect. I'm not a therapist, and you guys are caring for patients and residents and individuals in different areas, and it's so great. So let's hear about what you're doing. So Emily, let's start with you. Tell me more about, well, first of all, your education, what you did before you started your business. Tell us about you.
Sure. Well, I'm an occupational therapist, and I've been doing this for a little over 20 years. Spent most of that time in skilled nursing facilities. I was a staff therapist. I've been a director of rehab, single site management, worked at the corporate level doing clinical programming, training, managed student internship roles and such. In addition to that, I've also worked in independent living, in assisted living settings, home health, outpatient, kind of run the gamut really. But throughout all of that, I've had opportunity to interact with and work with people who are living with various forms of dementia. And I guess it was probably 10 or 12 years ago, I first had the opportunity to meet Teepa Snow at a state conference. I attended one of her talks and was just blown away by her knowledge, by her ability to make it understandable, and practical as well. So, so many times we attend dementia training and it's talking about different types of dementia and how it's diagnosed and what the prognosis is, but it doesn't talk about practical application and how can we interact with the person who's living with dementia, which is what we're here to do. And so that really got me intrigued with Teepa Snow. Fast forward a few years, and I was tasked with the job of finding a train the trainer type dementia certification program that I could roll out in the company that I was working for at the time. And of course, Teepa Snow was one of the first to come to mind. To be fair, I did research several others, but the benefits of Teepa's training and the ongoing support that you get from her and from the entire PAC community really won me over and won the rest of the team over. So Lori and I were able to get certified through that process. And of course, there were a number of changes in our industry. There were changes in the nation with COVID and everything. And at some point during all that, Lori and I decided, you know what, there are some pretty big gaps in training that's provided to healthcare workers. Mm-hmm. And so we decided to start our company to hopefully help fill some of those gaps.
Awesome. Awesome. And your partner has so many different experiences and education. So Lori, tell us about you and your background.
Hello. Thank you so much for having us. We're super excited to be here. So a little bit about myself. I'm from Florida, and I moved out to Texas about 15 years ago. And I have been working as a licensed speech-language pathologist for 26 plus years now. And I actually started out my career as a speech assistant, and then I went back to get my master's within a couple of years. So I have worked primarily in the skilled nursing setting, but I have also worked in inpatient rehab, acute rehab, home health, outpatient, assisted living, memory support, independent living. And again, like I said, skilled nursing has been primarily where my heart has been. I worked as a clinician, and then I also became a director of rehab, a floating director of rehab, an area director, a regional vice president, and then a senior vice president covering physical, occupational, and speech therapy for a company. So kind of done a little bit of everything on the operations side and clinical side. But my heart, of course, has always been patient care. One of the things we talk about as therapists is we educate, and that's educating the patient, educating the caregiver, and we get return demonstration. And so just to go along with what Emily said, that's what we loved about Teepa Snow and the Snow approach and positive approach to care, is the fact that everything is hands-on skill. And so it goes along with what we as therapists do all the time, education, getting people to apply that knowledge and get that return demonstration of skill so that they can continue to carry it out. So those are our passions and our love, and being able to start our own company and take this to levels that we want it to go and to where we want for persons living with dementia and their care partners to go is our passion.
Can you tell me a little bit about Empowering Care Partners? Yeah, and why did you guys start a business?
Yeah, so Empowering Care Partners, again, we are taking our passions. Emily as an occupational therapist, and when we talk about OT, not to steal Emily's thunder, but activities of daily living, and I'll let her expand on activities of daily living, and myself taking my passions of swallowing, communication, eating, and eating well, are all of our passions rolled in together. And so we decided that if we take our passion for geriatrics, dementia care, and all of those things that I mentioned, that we can come at it from an extra level that maybe some other individuals might not be able to, and bring that to the table. And so that's kind of why we started Empowering Care Partners. Our name kind of says it all. Empowering, we like to empower people. Care is at the crux of everything that we do. And then partnering. So partnering for the betterment of persons living with dementia and their care partners.
Exciting.
So Emily, I'll let you expand too.
Yeah.
Sure. So Lori mentioned activities of daily living, or ADLs. The way I like to explain that to my patients is it's pretty much everything that you do over the course of your day. For many years, I described it as anything you do from the moment you open your eyes in the morning until you close them at night. But honestly, sleep is an important ADL, and it's gaining more and more attention as well. And that's something that can be tricky for those who are living with dementia, as the sleep-wake cycle can get disturbed and flipped around. So they tend to be awake at night and sleepier during the day. But sleep hygiene is important, being able to set up the environment to be successful. Plus, we know as we get older, many of us have to get up in the night to use the bathroom or something along those lines. So ADLs really encompasses all of those activities. Some of the primary ones that we tend to focus on: the dressing, going to the bathroom, bathing, eating, hygiene and grooming tasks, but it includes other things as well. And it depends on what's important to that person. So if they have a beloved pet they want to care for, then it's part of my job to help make sure they can do so. If they enjoy cooking or gardening, those things are included as well. So it's a nice way to just encompass everything that a person does over the course of their day. I also wanted to mention, as part of our name, that CARE is an acronym, and it actually stands for our company values of compassion, acceptance, reliability, and education. And so you may see on some of our social media or our website, we'll have CARE written normally. Sometimes it's in all caps. And we feel like all of that is encompassed in caring for and with those who are living with dementia.
Wow, that's amazing. And it's so obvious you guys have put so much time and energy and thought into the mission of this business too. I love it. Would you say, looking back on your education, did you get much dementia education? I mean, when I think back 40, almost 40 years ago, becoming a nurse, we didn't get anything on really dementia. There might have been a little bit on psych issues and, schizophrenia, bipolar, but did you guys get much education on this?
Very little. I did get some, but honestly, 20 years ago or so, the impression out there among many therapists was if we put a dementia diagnosis on our therapy claims that we submitted to Medicare, they would get denied. And that did happen for a while where they were getting denied because if the person's got dementia, they don't have the capacity to learn. So what are we doing for them as therapists? And it took a lot of time and effort to reverse some of that. Thankfully, there was a lawsuit a number of years ago, Gemo versus Sibelius. You may be familiar with that one, Teresa, where they sued CMS for denying claims for people who have a progressive diagnosis. Started out based on a particular patient who I believe had Parkinson's, but they expanded it to include any progressive diagnosis. And so it really raised awareness as to what Medicare would cover when it comes to a diagnosis such as dementia that is progressive. It is going to change and advance over time, and where the skills of a therapist come into play as we're working with those people.
And how sad is that? Because the longer I have my business, the longer I'm interacting with clients, with residents, with people who have diagnosis. Wow. We sometimes throw the baby out with the bathwater, because just because a part of my brain isn't working doesn't mean my whole brain isn't working. And so many parts of the brain can be working. And we've certainly learned with Parkinson's, you can train these people and help them learn about new ways in their brain to complete physical activities, to walk a little differently. So amazing what you're able to do. So that is amazing. But I'm thankful that we're finally moving in the right direction, because this isn't going away. And we're diagnosing earlier and earlier. So to deny all the people that would have a diagnosis would be appalling. Wow. Okay.
Yeah,
So
absolutely.
what is the difference between, in your opinion, caregiver and, say, a care partner?
Yeah, so a caregiver is someone who gives care, right? So a lot of times a caregiver goes in and does for someone, but a care partner actually partners. So what's important is kind of as we were just talking about the Gemo versus Sibelius case, it's important that we all appreciate that even as someone progresses through their disease process, they have things that they still can do. And our job is to hone on the things that they still can do and allow them to do as much of that for themselves that they can. And so being a care partner, you're able to appreciate those nuances. You're their partner. You know that there's changes. You know that these changes can be fluid, and you're able to appreciate and understand where the person living with dementia is at that given time and adjust accordingly so that they can do as much as they can for themselves. They can control what they can control at that time and be as independent as possible. So for us, a care partner is someone that does just that. It's a small word shift, so it might not seem like it's a big deal, but it's not doing to someone, but allowing them to be a partner and do with them. And that's critically important to understand and appreciate.
Absolutely. We're joining them on their journey, their personal journey. And aren't they all on a different journey? Aren't all people different? What does Teepa say? You met one person that has dementia, you've met one person. And it's so true. It's so true that they're all different. And in my world, to be able to come in and just see where they are today, because they might be in a different place than where they were the last time I came in to give care or just interact with them or do an assessment. So I love what you guys are doing. What areas of opportunity do you see for more training?
Oh my goodness, there are just so many. And the more we learn, the more opportunities we see. I mentioned a little bit ago about, standard training for us as healthcare workers being, facts and figures. And it's often completed on a computer. So no real interaction, and you complete a little true false quiz at the end, maybe some multiple choice. And if you pass it with 80%, then great, you can treat. But when I'm faced with a patient or a person who won't sit still long enough to eat a meal, they're just up and on the move. They're constantly going. Can't get them to sit down long enough to eat a meal. It doesn't help for me to know that there are over 120 different types of dementia. It doesn't help for me to know that there's no cure and it is progressive and it will ultimately be fatal. What helps is for me to know some options that I can do to partner with that person who's living with dementia and meet them where they are. So, okay, they won't sit still more than a couple of minutes right now. So can I look at a finger food diet? Will they hold a sandwich and walk around and eat it? Right? So it's things like that, that's the gap that I see. Getting in there, being live for that training, and doing it in the moment with those who are caring with someone living with dementia. The opportunities, though, are endless. That particular example that I just gave is probably more appropriate for an inpatient or residential type setting, skilled nursing facility, assisted living, memory care, something of that nature. But if you think about it, in the early stages of dementia, people are often living at home, out in the community, in an independent living community, maybe.
Or driving.
Or driving still. And, they're perfectly fine. So think about all the people who you or I would interact with on any given day. It's the same people they would interact with. And if we had a little bit of understanding of what might be going on with this person, think about the barista at Starbucks or the checker at the grocery store, a bank teller, policeman. You think about somebody who's prone to wandering, and police may be called to help find this person who's wandered off. And how do they interact with that person once they do find them? Mm-hmm. And is that a positive experience, or is it not so much?
Right. Yeah.
So I think the possibilities are endless.
Yeah, because really everybody needs an education on this. And have you found in your training that sometimes you get the feeling that, yeah, I get dementia. My grandma had that. And you're thinking, yeah, but wait till it happens to someone closer than that. Wait till it's your spouse or your mom. It's different. I mean, I had a decade of decline with my mom. I thought I understood dementia. And I can tell you, doing a lot of CEs, with whatever profession, therapists, nurses, professionals, they sometimes would come in with their 3 cell phones. And I think they were just biding time to check the box to get the CE. And for me to be able to say to them, look, I'd been a nurse 30 years when my mother threw me out of the house. It was a rude awakening that there's so much more to this than meets the eye, so much more. And we got to figure it out, and we got to be prepared. We got to understand these folks because their situations matter too. And we need to be able to still go in and give care. Teepa talks about probably 70% of the behaviors are caused by us, and some people just can't believe that, but it's true. And it's not that people mean to mess up. It's just that they've never been taught better technique on how to approach. Start with that, how to approach. I need to hear some stories, some patient stories, no names, of course. My audience loves stories. Can you guys think of a couple of stories to share with me about folks you've cared for and how that has worked out?
So I can go first. One of the things I want to say, first, of course, is geriatrics is obviously I love. And although we're going to share some stories about individuals living with dementia, one of the things I love about working with geriatrics are the stories they have to share with us. And even sometimes, when they are not able to be in the here and now, and they're not able to relay biographical information and relay immediate recall. So, being able to get information and giving it right back, or short term, you can mention something that triggers for them from long term for them that happened in the past, and they're able to share that story. And that's what is so critical and valuable for us as, dementia care partners with them and trainers, but also as clinicians and also as a person. They've enriched my life so much along the way. One of my favorite stories is that because I use this as an educational piece, because I think it's so huge and it plays right into behaviors. And we always say behaviors rather than behaviors, in that we sometimes can increase someone's behaviors or outbursts, is more about trying to figure out their behavior and what need they might need that we need to meet for them. That's unmet need, we call it.
Right.
So I remember one time I was training a speech therapist, and she was very new, and we were watching a care partner from across the way. And every time this patient went to stand up, the care partner put their hand on the shoulder and said, "Sit down." Probably saw it happen at least 10 times. And so I said to the speech therapist, I said, "Let's watch what's happening over here." And she said, "Okay." And I said, "So this person is trying to get up. That's their communication at this point." And I said, "Let's go over and talk to this person." I did not know this individual. I was in a building. I was there to help that new speech therapist. So I was in her territory, not in an environment I was familiar with. So I really didn't know the patient at all. And I walked over and I actually asked the patient, "I see you keep getting up. Is there something you need?" Actually, the patient told me right away, "I need to go to the bathroom." So I use it as a huge education piece. I mean, that one was pretty simple because the person verbally communicated what they wanted. And I use that as a huge communication piece for the new speech therapist to understand and appreciate unmet need, communication, but also for the team member to appreciate someone. A lot of times the behaviors, or what are perceived as behaviors, trying to get up, well, they want to keep them safe, sit back down so you don't fall, but they're getting up for a reason. So let's try to find that reason so we can support the need and the want that they have at that point in time. So that's one of my favorite takeaways.
And it happens all the time.
All the time.
Yep. Yeah. Emily, can you think of a story?
Oh gosh, I've got a couple. One of my favorites is when I was working with an OT in a skilled nursing facility, and a patient had been referred to OT because she had stopped feeding herself. And this OT said, "But Emily, she's got dementia. What am I going to do?" I said, "Well, let's go take a look at her." So we went down to the dining room, and she was sitting in a wheelchair in the dining room. She was slid all the way down in her wheelchair. So the back of her head was resting on the top of the back of that wheelchair. Her hips were all the way forward in the seat. Her legs were off of the footrest, off to the side. Her positioning was horrible. And because of that, the tabletop was about eye level for her.
Oh my
And so, of course, the plate's on top of that. So the first thing we need to do is get her sitting up in her chair. We were able to find a better cushion to put under her, better leg rest to attach to the wheelchair so that she could actually sit properly in that chair and stay sitting properly in that chair, because I'm sure she started out just fine. The problem is over time, as she got fatigued, she slid down. And that's something that we as therapists need to watch for. But once we got her sitting up and we got her pulled up to the table, and positioning at the table was much better, I noticed that her plate was white, sitting on a beige tray. There was a white bowl sitting on the plate with a vegetable or something in it. There were 2 cups still covered in clear saran wrap over the top, and her utensils were wrapped in a white napkin and tucked under the edge of the plate. She had no idea what to do with any of that. So I pushed her tray back away from her. I took the bowl and I took one utensil, the appropriate utensil, and I handed her just those 2 things. And she ate. And so I refilled the bowl with something else from her plate, and she ate that too. And we kept going until she started to slow down. And I looked at her and I said, "Are you full?" Yes. She was so relieved. She was hungry, poor thing, but didn't know what to do. Couldn't see her plate, couldn't distinguish the white plate from the white bowl from the white napkin, or even know to look in the napkin for utensils. She had no idea. So I asked the OT, I said, "Great, are we done here?" "Yeah, she fed herself." "No, this was lunch today." "Where does she normally eat breakfast?" Well, she's probably still in bed." "Okay, so how does that change the task and what she's able to do? And what about dinner? What time is dinner served?" "At 5 o'clock." "And what do we often see happen with our residents who have dementia around the evening hours?" Well, they tend to get a little more anxious, a little more agitated. Some call it sundowning. So we need to assess all 3 meals. And we also need to see, she did fine today with this setup, but what about tomorrow? Tomorrow's a new day and a different day. So, working with her on seeing, could I change the patient? Did I make any difference in her cognition, her ability to grasp the utensil, bring it to her mouth? No. But I changed her environment, and I changed the supports that she had, and I changed the task that she needed to do. And that made all the difference in the world. And I think that's been a real eye-opening challenge for a lot of our therapists as I've gone through with them. Sometimes you can't change the patient. If they've got dementia, I'm not going to change their cognition. I'm not going to change their ability to learn or retain information. But I can make other changes that can really support their ability to participate and be part of that care process, because staff was just feeding this lady.
Oh.
And that's a dignity thing. So I think it makes a big difference, just being able to partner with the person who's living with dementia, see what they're still capable of doing, and provide that level of support. And then helping the caregivers to see, here's what you can do. Here's how you need to set her up for success, because she can be successful.
Absolutely. I love what you guys are doing. In my experience, there have been some caregivers that are afraid of these individuals because they act different. They do things differently, or they can't communicate properly, accurately. And so sometimes I'm afraid that they get written off. And so I love what you guys are doing. And it's not rocket science either. It's not, that they have to, I don't know, retrain the hand to use the fork, it's not rocket science, but it's just some basic things. Even if it was just allowing her to finger food or something. I had a woman that they just kept complaining about. She kept stealing food across the table. But when I watched them put the food out, she, think of what she can see. And she saw his chicken nuggets. So she would reach across the table to get his chicken nuggets. And I'm like, she can't see her own chicken nuggets, And so yet we're blaming her and finger wagging and no, and chastising. And, where's the dignity in that? It's out the window. But I do think that there is a certain portion of our caregivers that, because they're not trained to understand why they do what they do, there's a certain element of fear. And so they're just kind of like, yeah, you can't do anything. with them, but yet there's so much life in there. And I love what you guys are saying about we can learn from them so much. We can really can learn so much if we'll just take the time to get involved and to spend some extra skills working with these individuals. Any more stories?
Oh, I could go on and on for days, but yeah,
I know.
you know, a big passion of mine is swallowing and eating well. And
Right.
so, you know, speech therapists and occupational therapists work together quite a bit. And, you know, I work with individuals all the way through the end stages. You know, with Teepa, we talk about, you know, the pearl stage. And so I work with people and their family members and care partners to understand and appreciate what they might be seeing at those later stages, and to understand the process, and that, you know, at that point, we're not going for calories per se, but we might be going for comfort. And so helping people to understand again as the disease progresses, where we are in meeting the person living with dementia where they are, even from a safety and swallow perspective. And so that's near and dear to my heart, and something that we do quite a bit. And not forgetting that when you start to see some swallowing difficulty, it's important to involve a speech language pathologist, a speech therapist, to come in and assess. That doesn't mean that we always come in and change diets, because that sometimes is what people think that we do, but it's about finding out what's best for that individual at that time. And are they managing their clinical risk? They might be having symptoms, but from a dignity perspective, are they managing their risk? And let them have what they desire. You know, we always say all the time, the person living with dementia is the expert by experience, right? Mm-hmm. And their care partners that take care of them 24/7 are also those experts by experience. And so it's up to us to understand and appreciate where they're coming from as well, to make sure we carry out their wishes and their desires, and from a dignity perspective as well.
I love it. I could talk to you guys all day, because I love your stories, because I've seen so much of it, good and bad. And you guys are doing some great things out there. Can you just tell me, how do people get a hold of you? They want more information. They need your training. How can they get a hold of you?
Great. They can go to our website, www.empoweringcarepartners.com. That's the name of our company, and it's our website. So very simple. There are a couple places on there where you can click a link to request a free 30-minute consultation. Send us your information. We'll reach out and see what we can set up.
I love it.
And you can also follow us on Facebook, social media. So you can follow us on Facebook, LinkedIn, and Instagram as well.
So great. Listen, your future is so bright. I just want you to know, and if I can be just a little piece of getting the word out there, it's a thrill for me to do this for you. So, hey, everybody out there, you need to share this, because there are so many of your friends and relatives that need this information. And these ladies have lots of experience and lots of wisdom to share for you. All right. I appreciate you being here. Thanks again for following us on Memory Care with Teresa Youngstrom. I just want to remind you guys, you got this.